Hi everyone, welcome to our presentation on the Transtheoretical Model of Change. Today it will be presented by Claire, Niamh and myself, Anna. We hope you enjoy. So here is an image displaying the 6 stages of the Transtheoretical Model of Change. You can see it goes from pre-contemplation to preparation, to action, to maintenance and then to relapse. So what is the Transtheoretical Model of Change? The Transtheoretical Model is a model of intentional change which focuses on decision-making of an individual. In the past, behaviour change was seen as a discrete event. However, the Transtheoretical Model suggests that health behaviour change involves the progress through 6 stages of change: pre-contemplation, contemplation, preparation, action, maintenance and relapse. Some models use a termination stage. However, termination was not part of the original model and is less often used in application of stages of change for health-related behaviours. The journey through the Transtheoretical Model is not usually linear but cyclic. Individuals can move forward or backwards through the stages of change. So the development of the Transtheoretical Model of Change. The Transtheoretical Model of Change was developed by Prochaska and de Clement in the 1970s and first proposed in 1983. The model was developed by examining experiences of smokers who quit smoking on their own but needed more information to understand why some people were capable of quitting on their own. It was created using concepts from many different models of psychotherapy. The model has been applied to many health-related behaviours. The Transtheoretical Model is a model of intentional change. The model focuses on the decision-making of the individual. In the Transtheoretical Model, it is assumed that people do not change their behaviours quickly and decisively. Instead, this change in habitual behaviour occurs continuously throughout a cycle process. So the implementation of the model. The Transtheoretical Model is often used in healthcare, especially in areas such as smoking cessation and increasing physical activity. The Transtheoretical Model is also used in research assessing behaviour change in these issues. Some studies focus on the 6 stages of change, whereas some studies focus on some aspects of the 6 stages of change. The Transtheoretical Model can also be used as a measure of the effectiveness of a behaviour change in an intervention. Evidence examining the effectiveness of Transtheoretical Model in interventions is mixed, with some studies finding positive outcomes, some mixed results, and some inconclusive findings. The Transtheoretical Model is also used to examine adherence to treatment. One study found statistically significant results in a stage-based intervention compared to a non-stage-based intervention in psychiatric patients.
We met with Laura Andrews, a registered dietitian, and asked her a series of questions about the Transtheoretical Model of Change. The first question is, use the Transtheoretical Model in practice.
So that, I suppose, is a tricky one, because I suppose on ward level in, I suppose, a busy acute hospital, it's kind of difficult to, I suppose, apply the theoretical side of things, I suppose, in the way that is set out, I suppose, in the 6 steps. I suppose it's probably different elements of it are probably used, like different elements of the theory are probably used kind of at different times with different patients. So yeah, I probably would use it, but I wouldn't, let's say, use it in, I know it's the circle kind of the 6 steps. It probably wouldn't be used, let's say, as rigidly or kind of as each step kind of as it would be, let's say, in a different setting, kind of like a community setting where patients would be more well and you'd have, I suppose, a longer amount of time to kind of see them and to maybe promote the behaviour change. And I suppose it depends on the patient type as well. So the patient types would be different.
Here that you'd be seeing. So sometimes it can be difficult to apply the theory, but I suppose the elements of it would be applied on board level.
The second question we asked Laura was if she said she does use the transtheoretical model of change, could she give us an example of where she would use it in her practice?
I suppose there's loads of different patient types that you could use it. So maybe if you had a newly formed stoma, so patient maybe with an ileostomy. So for them, their, I suppose, behaviour for the first kind of 4 to 6 weeks after surgery are really important to try help with the recovery. So you'd, be educating them on the changes that they'd have to make to their diet. Kind of, I suppose the pre-contemplation phase is kind of, they'd be post-surgery, so there'd be a lot going on. But just to kind of plant the seeds, and the doctors as well would kind of suggested they follow low fibre for the first 4 to 6 weeks, so it's kind of just implementing that behaviour.
The third question we asked Laura was whether she thought the transtheoretical model was an effective model for behaviour change for use in a dietetics practice.
I think, yeah, it is. I suppose, again, because you can kind of use it, you can kind of take elements of it in different levels. So, like on the ward level, like that, you don't go through every single step. You don't make it through. It's kind of taken over. So, but it is applicable in many settings. So, I do think that it is.
It is optional, but it's kind of not. So that can be kind of a disadvantage as well, that it's probably not applicable all of the time. But I suppose an advantage of it would be in that it does give the patient autonomy, and they're involved then in their care, and they're kind of, it's put back on them. It's kind of, is this something that maybe you think you could manage? It's kind of compromise with them as well, or kind of giving them options as well. So kind of giving them a choice, and they're as well involved, so they don't feel like they're being told, you can't eat this, you have to eat this. They're kind of like, oh yeah, this is maybe something I can manage. So I suppose it's good in that sense. It's given them more control, and they're kind of involved.
Yes, was there any situation
So I suppose maybe in patients that maybe don't have capacity to engage, so maybe patients who are like confused, or maybe have dementia, kind of things like that, where they don't have capacity, I suppose, to retain the information. So then in that sense, it's kind of nearly out of their control. So I suppose you could directly have the conversation with them and go through the stages, but it could be difficult, I suppose. It may not be appropriate in that they may not kind of be able to retain what you're saying.
It's physical inactivity of the factors of physical sedentary lifestyle is that is
of the transtheoretical model in promoting exercise, and to compare the use of the transtheoretical model in different age groups. Databases such as PubMed, Corcoran Library.
A cross-sectional study by Cardinal et al. On 69 school children aged between 5 and 11 years old found that half of the children were already in the maintenance stage. Around 9 years of age, the number of children in the maintenance stage declined. This decrease was accompanied by an increase in the number of children in the action stage of exercise. The study concluded that the conceptual framework provided by the TTM has the potential to provide the tailoring quality that appears to have been lacking in other models. Another study was conducted on the confirmatory factor analysis of the TTM of physical activity among Malaysian primary school children aged 10 to 12 years old. This study aimed to validate the TTM questionnaires on physical activity for Malaysian children using confirmatory factor analysis. This study provides insights into the use of TTM for physical activity in the Malaysian setting. Extensive modifications, particularly correlating the items, residuals, and removing problematic items, were needed to improve the model for younger children. Children were more open to participating in physical activity without a need or reason for change, and it is important that care is taken when using the TTM with children, as up until now it has been used with adults. Here are the findings of the research into adults and exercise. Han et al. Found that both males and females in later stages use some processes more often to avoid sedentary behaviour than those in earlier stages. Females were found to be more sedentary than males, with more males being in the maintenance stage. Females, however, were more likely to change their sedentary behaviours than males. It concluded that participants in earlier stages were less likely to utilise the TTM constructs to reduce sedentary behaviour than those in later stages. Similarly, another study by Callahan et al. Found that young adults responded to interventions that emphasised the benefits of exercise. This study found that 54% of young people were already in the preparation stage with regard to exercise. It concluded that progression through the stages was linked to students' self-efficacy, decisional balance, and the process of change. Abdi et al. Found that about half of the employees in a study were already in the preparatory stage of TTM. The TTM was useful to predict physical activity behaviour. Findings showed that the relationship between physical activity level and stage of change is significant. Employees who were in the maintenance phase were 3.28 times more likely to be classified as being active than those who were in the pre-contemplation stage. A study by Chung et al. Examined participants in a 16-week walking program. PROs increased steadily as stages of change progressed from contemplation to maintenance at follow-up. Contrary to the model prediction, cons did not decrease from preparation stage to action stage. This finding indicated that the cons of walking still played an important role in regular walking among the older participants. This implies that in general they had a tendency to remain concerned about the negative aspects of walking throughout the different stages. Also, the time frames for each stage might not make sense to some older people, and therefore are easily ignored. Yang et al. Used the TTM to promote behavioural change and to test the effects of a group senior elastic band exercise program on the functional fitness of 169 older adults. 87% of the participants switched to the action stage after 6 months of intervention. In contrast to the study above, providing group exercise courses and applying related enhancement strategies for those in the contemplation and preparation stages were appropriate and beneficial. Providing appropriate exercise prescriptions for people in the contemplation and preparation stages of behavioural change can effectively facilitate regular exercise behaviours and enhance the functional fitness of community older adults. Education programs based on the TTM are useful in changing behaviour in the physical activity of younger children. However, the TTM may not be as effective as children are more open to participating in physical activity without a reason for change. Adults respond strongly to interventions that emphasise the benefits of exercise. For adults, the TTM is useful to evaluate and predict physical activity behaviour and the relationship between physical activity level and the stage of change. Applying related enhancement strategies for older adults in the contemplation and preparation stages of the TCM have been appropriate and beneficial. However, older people remained concerned about the negative aspects throughout the different stages. Also, the time frame for each stage may not be applicable to older people. Thank you for watching our video. I hope you enjoyed it and found it informative.